All right, my name is Heikito Nikobo. This is my student badge. I'm going to scan my room 360 degrees. All right, so I have my patient here. She's a 17-year-old female admitted into the ER with complaints of nausea, vomiting, heavy chest, cough, and some stiffness of the neck. I'm looking at her vitals. Temperature is at 39.7 degrees Celsius. Heart rate is at 115 beats per minute. Respiration is at 22 beats per minute. All these vitals are abnormal. And the reasons for the high body temperature may be as a result of a systematic response to an infectious pathogen. And for the respiration, it could be a compensatory mechanism as the body is fighting the increase in body temperature. For the respiration, which is 22 breaths per minute, this may be as a result of the heavy chestness that she complained on admission. I am going to go ahead and inspect, as part of my nursing intervention, I'm going to go ahead to see how to bring down the body temperature by administering an antipyretic ordered by the MD. This could be an acetaminophen. This will help to bring down the body temperature. I'm going to move on to inspecting my patient. Looking at her appearance, she looks sick. And looking at her behavior, I think she's been guarding her head. I'm looking at her paralysis. There's no obvious paralysis. Looking at her rigidity, she did complain that her neck is stiff. And looking at her motor movement is okay. Work of breathing, she's using some light associated muscles for breathing due to the heavy chest. I'm going to move on to PELA. So PELA represents people, equal, round, reactive to light, and accommodating. And I'm going to use my pen light to demonstrate that. We'll start by sizing the pupil. So looking at the pupil, her pupil is +3 on the right side, and on this left side as well is +3. I'm going to go ahead and test for reactive. Look, flashing the lights to the eyes. Can you look forward? Yeah. Can you look at the front? Test for accommodation. So, based on my assessment, the pupils are both reactive to light and accommodating. I'm going to go ahead and inspect the body again. Looking at her color matches to an ethnicity. There is no bruise or consent of that. Looking at her level of consciousness, I'm going to ask her some questions. Do you know where you are?
Yeah.
Do you know why you are here?
Yes.
Can you give me the date and the time?
June 14, 2026.
All right, so my patient is oriented ×3, place and time. And I'm going to go ahead and check for her accessory muscles. She doesn't use her accessory muscles that much. Work of breathing, she's a little bit labored with breathing due to the heavy chestness. Now I'm going to test for her hand grips. Can you hold my hands and squeeze them tight? Thank you. Can you raise your legs? Can you raise your legs? So my patients, both the arms and the limbs are both strong bilaterally. And I'm going to move next to say one of my concerns I might be having with my patient now is that I am suspecting that my patient is is going through some infectious pathogen, which could possibly be that she's suffering from pneumonia. So I'm going to go ahead and do auscultation of inspection of the thorax. So looking at the thorax, I don't see any lesion or bruise, and there is no paradoxical movement of the chest. Going to palpation, I'm going to use the dorsal of my arm to palpate for temperature. So feeling the temperature, I can tell my patient is sick because her temperature is elevated. And I'm going to check for any lumps or bumps. I don't see any lumps or bumps, so everything's okay. I'm going to go ahead and auscultate the thorax. I'm going to use my stethoscope, and I'll use the diaphragm of my stethoscope to do that. So whenever I put this on your chest, please take a deep breath and breathe out through your mouth or your nose. I'm going to start from the clavicle. So based on my assessment, I could get some coarse crackles at the base of the lung, and this could be as a result of the cough that she reported and some heaviness of the chest. So part of the interventions that I am going to do as a nurse, I'm going to go ahead and elevate the head of the bed up to about 45 degrees. This will ease with the breathing, and I'm also going to go ahead and monitor for any for fluid electrolyte and fluid balance, so her input and output, and some of the recommendations that I think the doctor can put in place is that one, the doctor might order for lumbar puncture to check for the cerebrospinal fluid and for blood culture as well to check for the infectious pathogen that might be causing the meningitis. And for the other recommendation that the doctor might put in place, the doctor can also order for an antibiotics for the treatment of the infectious disease. Thank you so very much.